Hey everybody, so we are going to go ahead and get started with our next unit here. So our first unit actually. We're going to be talking about career clusters, education levels, and healthcare facilities. And so this is the basis of our units, the rest of our units. So we're going to go ahead and get started. And let's see here. So what I'd like you to do too is to follow along with your notes, the ones that you got from class. Okay, these are going to be the objectives that we're going to learn about. I'm not going to spend a ton of time on these. You guys can read these, but this is what we're going to accomplish when we are finished with this unit. Okay, the first thing I want to talk about is organizational structures and lines of authority. What this means is that you need to know whatever healthcare facility you're working in, where you fall in the chain of command. So healthcare workers need to know where they fall. So if you think about this, if you're a certified nursing assistant and you are working in the hospital, you need to know like who is above you if you have a problem, who is below you, who can you talk to, who can you be the problem solver for. So if we think about even in a school situation, we have this going on too. If you have a problem with another student here at school, who do you go to first? Do you go straight to the school board? Probably would get into trouble if you did something like that. So normally, if you have a problem with a student, you would first maybe try to address that problem with the student, right? After that, if it doesn't get resolved there, you might go to the counselor or to the assistant principal. If it doesn't get resolved there, you might go to the principal next. If it doesn't get resolved there, you might go to the assistant superintendent, and then maybe the superintendent, and then maybe the school board. Same thing happens in a hospital. So if we take a look here, let's say that you are a registered nurse, and you're working as a registered nurse, and you have a problem with one of your coworkers. Who would you go to next? Would you go straight to the hospital board? Probably not. You would have to first talk to that other registered nurse, and then maybe go to the head or charge nurse and the nursing supervisor, and so on and so forth. So it all just depends on what facility you're working in. Clinics might look a little bit different. Every hospital is a little bit different, but wherever you're working, you need to know kind of where you fall in that chain of command. Okay. Next thing I'm going to have you do is after I tell you the instructions, pause the video, but take out a piece of paper and write down as many different medical careers as you can think of. Once you're done with that, we're actually going to put those into categories. Okay, so pause, do that. Okay, now that you've done that, we're going to move on to career pathways. So all of the careers that you wrote down fall under one of 5 career pathways. And a career pathway is a medical or health-related career that are grouped together based on different types of services that are provided and also the types of people that are served or the clients or patients. Okay, these are the 5 different career pathways. We have therapeutic careers, diagnostic, health information, support services, and biotechnology research careers. All right. The first one is therapeutic careers, and these are careers that provide a direct service to the patient. They often see the patient over longer periods of time. So things like nursing or physical therapy, occupational therapy, speech therapy, respiratory therapy, pharmacy, emergency medical services, doctors or physicians, and psychologists. These people spend the most time with the patient. They spend the most time. Maybe you want to write that down. These people usually spend the most time with the patients. In order to do that, some skills that they would need to have is they have to be really good at collecting data. That data might include things like their vital signs. What's their heart rate? What's their temperature? It might be how did they score on this particular mental exam, okay? And then they're going to treatment plan for that patient. So how are they going to help that patient to get better? And how are they going to carry out those procedures? That's what we call implementation procedures. And then they're going to evaluate the client, and they're also going to work with other professionals to help to solve problems and to help work with that patient. Okay. Next up, we have diagnostic service careers. So these careers create a picture of the patient's status at one point in time. They're basically taking a piece of information from the patient to help figure out what's wrong with the patient. So for example, one of the things you all probably have had done at some point in time is blood work. So they take that blood from you and they figure out what's going on in your blood to be able to figure out what your health is right now. So people who do x-rays, okay, they're taking a picture of you to try to figure out what's going on inside of your body. Maybe it's a broken bone, or maybe it's something else that's going on. So they're getting that picture to try to figure out what's wrong with you. Medical labs, so the people who are doing the COVID testing, they're getting pieces of information, sputum, saliva, mucus secretions, to try to figure out if they have COVID or not. Okay. All right. So some of the skills that they would have to have if you're in a diagnostic career is you have to be really good at planning. You have to be really good at following procedures, protocols, evaluating and reporting, and you have to be precise. I can't stress that enough. Let's say if a person is drawing blood and they don't do something the right way, it could affect the results of the blood, and it might require that they have to redo that test again. Or it might mean that they give the wrong results, which is no fun. Nobody would like that. So you have to be really precise in order to do that. Story time for you. So speaking of people in the diagnostic careers, I have a cousin who many years ago, she found a lump in her breast, and she went to the doctor. She had a mammogram, and the radiologist read the mammogram and said, you know what, it's nothing to worry about. Everything is fine. And come to find out a year later, this person who was the radiologist was suffering from dementia. They found out that they needed to go back and look at all of her records. And as a result, my cousin found out that she had breast cancer, and it had been there for a long, long time. And that's just an example of how it's really important to be precise. The radiologist was suffering from dementia. And so, a lot of people probably didn't pick up on that, but she wasn't precise. And unfortunately, that diagnosis got pushed back a long time. And as a result, my cousin had to go through more extensive treatment. So just one example for you. All right, next up, the next career, the third career pathway or cluster is called health informatics. And one thing I want you to write down about this one is paperwork. These people do a lot of paperwork, or they're managing a lot of paperwork. So they're recording and managing information like medical records. They're coordinating units. I'm talking about hospital units. And then a lot of them are also doing medical coding. So every time you go to the doctor for something, there's a specific code that is related to whatever you were seeing the doctor for. So for example, there's a code if you're bitten by a cow. And those medical coders have to actually write that code in so that insurance will pay for it. So the code for bitten by a cow happens to be W55.21. There's also another one where if you've had an accident while knitting or crocheting, if you've been struck by a marine mammal, a shark attack. And another one is if there's a burn due to water skis on fire. Some of these are crazy, but there's literally codes for everything. And so these medical coders have to be able to find that information quickly and then to put it in the paperwork. So some skills with health informatics. If you're going to be in one of those careers, you've got to be really good at analyzing data, abstracting important information, medical coding, documentation, so writing things down, and then maintaining or managing that data, making sure that it's stored safely and securely. Okay. Next career pathway is support services. And support services are the people that aren't maybe necessarily directly working with patients, but they are providing a safe and healthy work environment for everyone else. So it allows everybody else to be able to do their jobs. So some examples of this would be environmental engineers. Okay, they're the ones who design the healthcare facilities. Biomedical engineers. These are people that if you really like technology and you like medicine, they make sure that all the medical equipment is properly maintained and documented. So that's kind of a neat job too. Or maybe an industrial hygienist. If any of you guys watch Grey's Anatomy or any of those other shows, you know, they walk into those surgery rooms. Those surgery rooms have to be sterilized by people. And an industrial hygienist those are some of the people that do that. They also have to, some of the skills that they have to have is that they have to understand how important it is to have a sterile or aseptic. Aseptic means germ-free environment. And also an aesthetic environment. Aesthetic means that it's neat in appearance, and it's going to make sure that people don't get tripped up and things like that. Okay. All right. Last career cluster, before we move on to some other things, are people that we often forget about. This career cluster or pathway is called the biotechnology research and development. So these people are highly scientific and involves development of equipment, procedures, and medication. So these are people that like to spend a lot of time in a lab. These are the people that are trying to create a coronavirus vaccine right now. So they understand a lot about medical research. They understand about disease processes. They explore environmental effects on the health. So other things that they might be exploring right now are, what are the effects of cell phone use on, you know, a developing brain? These people research all of that. Okay, so some of the careers might include biologists, scientists, biotechnologists, and it's really important to be precise and exact. They have to enjoy research. They have to enjoy spending a lot of time in a lab, lots of chemistries and things like that. So if you like those kinds of classes and you like to spend time in a lab, that might be a really good career pathway for you. So when we come back to class, we're actually going to be looking at the careers that you wrote down, and we're going to try to figure out which pathway those careers belong to. So when you come to class, please bring the list that you created of those careers. Okay. So now that we know about some of these careers, we have to talk about different educational pathways in order to get some of these careers. So there's different levels of education required for different pathways. You know, some careers, some medical careers only require that you have to have a high school diploma. Some have on-the-job training, and then some actually have advanced degrees. And it all just kind of depends on what you want to do. So in high school, you can actually start working on some of these pathways, because you could, as early as next year, you could take the CNA course and you could start working as a CNA. A CNA is a certified nursing assistant, and they make pretty good money. I would encourage you to think about that, especially if you're thinking about like nursing or maybe even becoming a doctor. If you have your CNA and you're applying to med school, that's going to look much more prominent for you when they're looking at applications than somebody who has no patient contact experience. Same thing for nursing too. If you're thinking about being a nurse, I really think that you should take the CNA class next year. This class is a prerequisite for that class. All right. So there's different levels of education beyond high school. First off, there are technical or career schools. And actually, our Career Academy is an example of that. So they provide training during and beyond high school. So as I mentioned before, the CNA class is part of that. Then beyond that, you could go to a community college. And the thing I want you to know about that is community colleges are usually a 2-year degree, a 1 to 2 year degree. What we call that is an associate's degree for 2 years. You should know that one too. It might be on a test someday. So some examples of careers that would be 2 years would be a surgical technologist. So if you want to be in the surgery room, but you don't want to go to 12 years to become a surgeon, you could become a surgical technologist, and you're the one who sterilizes the tools and things like that. And then also oftentimes hands them to the surgeon, which is kind of neat. Okay. You could also become a licensed practical nurse. That's a 2-year degree. Let's say you want to move beyond that. There are plenty of careers that require a bachelor's degree, a master's, or even a doctoral degree. And we'll get to know more of those things as we go throughout this, this class. All right, so let's say that you got your degree in whatever you're going to be. Maybe you're going to be a speech pathologist, okay? And you have your degree. Guess what? You're still not done learning yet, because all medical professionals have to do this thing called continuing education. And what continuing education is that when you get your medical license, whatever it is, you're never done learning, because you have to keep up to date with the most effective, with the most current trends of what's happening and how to treat people. So for example, for my OT license, I still maintain that I have to have 20 hours of continuing education every 2 years. And usually I can get those by just attending a seminar or a conference or things like that. So it's not actually necessarily taking a class. It's more like taking a seminar for that. So you have to have that in order to maintain your license. Okay, so we also have different levels of employment, all the way from, and I don't think you guys can see the aid part, but that's on the bottom of your note page there. And we're going to see a little bit more about these. So starting off at the very top, a medical professional is anybody with a 4-year degree, an advanced degree, or clinical training. So somebody who is a registered nurse who has their 4-year nursing degree, they would be considered a medical professional. A medical doctor, okay, they have a 4-year degree. A technologist in general is somebody with 3 to 4 years of college and work experience. A technician is somebody with usually 2 years of training. An assistant is usually somebody with 1 year of training. And then an aide is somebody who has a high school diploma or on-the-job training. Okay, so taking a look at some of these in real life, these are some of these career ladders where the more training that you have, the more money that you make. So an emergency medical technician or a paramedic are the people that work on the ambulances. So they don't have to have a specific degree, but some EMS people actually have an associate's degree. But you can actually become an EMT when you're 18 and you take certain classes or certain hours of training. And you think about these people that are doing all these crazy things to save your life, and they can start IVs and they can drill holes into your bone to start an IV if they have to, if your veins are collapsed. They're making $39,000 on average in Bismarck. Okay. So another thing you want to look at too when you're starting to plan for your life is what kind of a salary do you think you want, or what kind of a standard of living do you have, and will your salary match that? And then how long will you have to go to school in order to get that, and try to find the balance? That's the key. Okay, so here's another example of a career ladder. So somebody who is a scribe is somebody who just has on-the-job training. They work in the eye care facility. And sometimes they're, taking notes and things like that and paperwork, okay? An ophthalmic assistant is usually somebody who has a 1-year degree, and they can work with the ophthalmologist. An ophthalmologist is somebody who they're a medical doctor, and they chose to specialize in eyes. So they are the people who do eye surgeries and things like that, okay? An optician, oftentimes they're going to have a 1 or 2 year degree. They're going to be working alongside the optometrist. The optometrist, they're not a medical doctor, but they have their doctoral degree in optometry, and they specialize in eyes, but anything that would have to go to an eye surgeon would have to be to the ophthalmologist. So that's the difference there. And you can see the pay difference. Obviously, the more school that you go to, usually, the more money that you're going to be making. Okay. So Okay, so here's another one. So taking a look at the nursing world, like I said before, you guys could start becoming a CNA next year, a nurse assistant. And if you did that full time, you would, on average in Bismarck, make around $27,000 a year. But let's say you move on and you become a licensed practical nurse. That's a 1 or 2 year degree. You'll be making around $40,000. If you become a registered nurse, the average salary for that's a 4 year degree, would be about $64,000. If you're a nurse practitioner, which you're a registered nurse, and then you go to school for an additional 3 to 4 years, you now have your doctoral degree in nurse practitioner. Average salary in North Dakota is about $90,000, but plenty of nurse practitioners make more than that. Or you could become a certified nurse anesthetist, which a nurse anesthetist is somebody who works alongside the anesthesiologist, but they can also use the medications to be able to put someone under during surgery, which is really cool. So that is a registered nurse. They have to be working in emergency care or in the ICU for at least a year, and then they can apply to nurse anesthetist school, which is the mouthful to say. And then they can become a nurse anesthetist and work with those medications. So you can see the pay difference with those. All right, moving on. So now we're going to be talking a little bit about scope of practice. So scope of practice is what you can do in your profession based on your clinical training and your education. So here's an example of that. So if I am a CNA, I'm a certified nursing assistant, it is within my scope of practice. I have been trained on how to properly care for a patient and bathe a patient. I have not been trained on how to do stitches on a patient. That's not within my scope of practice. Okay. If I'm a chiropractor, my training will tell me how to properly align the spine. My training is not going to be able to I'm not going to be able to do back surgery. Okay. So scope of practice is what you're allowed to do. And there are laws related to that. So you can't just go out and say, I'm going to try doing this. There's certain laws. And if you are found doing the things that you're not allowed to do, you can actually lose your license and possibly have jail time. Nobody wants that. All right, moving on. So talking about opportunities. So many healthcare providers like to start their own business. So if you think about some of the healthcare professions in town that have their own businesses, you probably think about like dentists, chiropractors, physical therapists can also do this. Occupational therapists can now have their own businesses. So an entrepreneur, you should underline that, are the people who organize, manage, and they take on the risks of managing a business. In order to do that, they need to have a business plan. It's really, really important to have a business plan as well. So some of these people also take business classes. Okay, so you're going to be hearing more about HOSA, and we'll watch this video in class here too, but HOSA is an organization, it's a student organization for people who are interested in a medical career. There's different things that we do in HOSA. We provide leadership opportunities, usually through competitions. I will tell you that we typically get started early in the fall. However, things are on hold, as many other things are right now. So if we are able to have HOSA and have competition, and do some of our community service and things like that, I will make sure to let my classes know of this opportunity. Okay, we are going to move on. And you know what? That is a really good place to stop. So make sure you have your note packets filled out by class, because there's going to be some things that we do related to that when you come back to class. All right, thank you.